In human history, few pandemics have had such a devastating impact as the Spanish flu of 1918. Emerging in the final months of World War I, this viral disease spread rapidly across all continents, leaving an estimated 50 to 100 million dead in its wake, more than the actual victims of the war itself. Despite its magnitude, the Spanish flu remained a silenced or minimized tragedy for decades, overshadowed by the major political and social events of time. Contrary to what its name suggests, the flu did not originate in Spain. Its exact location is unknown, although theories point to the United States, France, or China as possible initial outbreaks. The term Spanish became popular because Spain, not being involved in World War I, did not censor press, unlike the belligerent countries. While other nations concealed the severity of the outbreak to minimize war morale, the Spanish media freely reported on cases and deaths, creating the false impression that Spain was the epicenter of the disease. The virus responsible was a particularly virulent strain of influenza A, subtype H1N1, which evolved rapidly and presented aggressive symptoms. Unlike other flu epidemics, the 1918 flu epidemic most severely affected healthy young adults between the ages of 20 and 40, which baffled doctors at the time. Symptoms included high fever, severe muscle aches, rapid pneumonia, and, in the most severe cases, a bluish complexion due to lack of oxygen. Many patients died within days or even hours. Hospitals collapsed under the avalanche of patients. The Spanish flu spread in three main waves. The first, in the spring of 1918, was relatively mild, although highly contagious. The second wave, which began in the fall of the same year, was the most lethal. The virus had mutated into a much more aggressive form and caused most of the deaths. The third wave, in early 1919, was less intense but still claimed numerous lives. It is estimated that one-third of the world's population was infected at a time when antivirals, antibiotics, to treat secondary infections, and vaccines were unavailable. The impact of the pandemic was devastating in every way. Entire cities were paralyzed. In many regions, schools, churches, and theaters closed. Essential services such as garbage collection and transportation ceased due to staff shortages. In some communities, authorities resorted to mass burials because there weren't enough coffins or gravediggers. In hospitals, doctors and nurses worked to exhaustion and often fell ill and died. Masks became common, as did social distancing measures, although without the coordination or epidemiological knowledge required to confront pandemics today. Interestingly, despite its global impact, the Spanish flu didn't leave as strong a cultural imprint as other catastrophes. This was partly because public attention was focused on the end of the war and the rebuilding of the world order. Furthermore, the disease wasn't fully understood. Talking about it generated more fear than a sense of community. In many families, stories about the pandemic were passed on in silence, like painful memories best left undisturbed. From a scientific perspective, the 1918 flu represented a turning point. Although viruses could not yet be seen with microscopes at the time, the pandemic spurred the development of modern virology. Decades later, in 1933, the influenza virus was first identified. In the 2000s, the genome of the 1918 virus was sequenced from the frozen remains of victims. This breakthrough has been key to better understanding influenza virus mutations and preparing for future pandemics. The 1918 experience also held important lessons for public health. The need for clear communication, internationally coordinated responses, and robust health systems became evident. However, many of these lessons were forgotten over time until other pandemics, such as H1N1 in 2009 or COVID-19 in 2020, brought them back to global attention. In retrospect, the Spanish flu was more than a pandemic. It was a human tragedy that showed the vulnerability of civilization to an invisible threat. Although the world has changed greatly since 1918, the questions it raised remain. How prepared are we for a new pandemic? How do we balance science, politics, and communication in times of crisis? And how do we honor the memory of those who died in oblivion? Today, more than a century later, the story of the Spanish flu reminds us that global health is a fragile asset and that solidarity, knowledge, and collective memory are our best defenses against the threats of the future. If you want to know other interesting stories, you can follow my YouTube channel, Frank Fernandez Historia.